Go. Hi, Anna. Thank you for taking some time to speak with me. Before we begin, I'd like to check, are you comfortable having this conversation here?
Yes.
Okay, that's great to know because I want a quiet and private conversation as possible. However, I got a management meeting in 10 minutes. I don't want to feel that you're rushing. If we need more time, I will schedule another follow-up. Today, I'd like to ask about three things. I'd like to tell you some feedback. Is that okay for you?
Okay, that's fine.
Thank you. So before I start, I want you to know that this is intended to help in your learning. Sometimes receiving a bit of difficult feedback will make you feel uncomfortable, but I want you to be ensure that we can discuss this openly. Is that okay?
Yes.
So let's start with how you see things. How do you think your placement has been going so far?
I think it's been going reasonably well. Obviously, I'm still learning, but every situation is a learning experience.
Good that you're seeing that the clinical placement is an opportunity for you to learn from different situations. Which part is going particularly well?
I think I'm getting more confident with patients and with the ward routine.
That's good to hear. Can you give me an example of a situation where you felt that your confidence had improved?
I've become more comfortable speaking to patients and discussing what needs to be done.
That's encouraging. How about the areas that you're less confident? What comes to mind?
Sometimes I don't know exactly what to do, but I think that's normal because I'm still a student.
Yes, you're right. Sometimes uncertainty is being part of a student, and knowing when to ask for help is important. When you're uncertain, what usually helps you to decide whether to continue independently or ask someone for assistance?
Usually I see what the others are doing or I ask someone if I'm really unsure.
Okay, that's good that you are aware that you have to seek help. As now you're in your final year, there's additional expectation. We need to see that you recognize your limitations and seek help early. How do you feel about the expectation as you approach graduation?
I'll think I'll improve with more experience once I graduate and start working. I'll be doing these things every day.
I hear that your confidence will increase with experience. We'll come back to that later because I want to tell you what you can do now rather than wait until after graduation. Is there anything about your clinical placement that you think I should know?
A ward can be very busy and sometimes the patients are difficult. I think that affects how things go.
That's helpful for me to understand. Experiencing the workload and patient interactions sometimes can be very difficult for you to perform at your best.
Yes.
Thank you for explaining that. So there are actually three areas that I want to tell you about. The first is the clinical skills and decision making. Sometimes um, you may be uncertain about what is the next step to do. I am not expecting you as a final year student to know everything or to manage every situation independently. My concern is whether you can seek help early enough to maintain patient safety.
But I do ask for help when I need it.
I hear you. You are saying that you do recognize when you need help, but at the same time, a lot of people say that, you need a lot of prompting before taking appropriate action. I'd like to understand from your point of view. Can you think of any recent situation where this actually happened and you weren't sure what to do clinically?
There was one patient where I wasn't sure what to do next, so I waited to see what the others were doing.
Okay, what was going through your mind at that point?
I didn't want to do the wrong thing.
That's understandable. You were trying to avoid making an incorrect decision, and waiting seemed safer to you at that moment.
Yes,
I understand. You were trying to avoid making an unsafe decision, and waiting felt safer. What could you do differently next time?
I could tell the supervisor that I'm not sure what to do.
Exactly. You can always say to the doctor, doctor, I'm not very confident what is my next step. What I think I should do. Could you confirm whether this is appropriate? That will
I
demonstrate, both clinical reasoning and recognition of your limits. Would you be comfortable trying that?
I could try that.
Good. So rather than expecting yourself to know everything, the goal is to demonstrate that you recognize uncertainty and seek appropriate help. The second area I'd like to bring up is about teamwork. Some people mention that um, you need some help with that. How do you think you work with the other members of the team?
I think I'm okay. Sometimes people don't listen to me though.
So sometimes you feel that your contribution isn't being heard. Can you tell me more about that?
Sometimes I suggest something and someone else disagrees. Then it feels like they don't want to listen to me.
I can see how they can be frustrating, especially you make an effort to contribute. When someone disagrees with you, what do you usually do?
Sometimes I just leave it because there's no point arguing.
Okay, so you're trying to avoid conflict.
Yes,
That's understandable. Avoiding unnecessary conflict is helpful. However, I think when you disagree with someone, how can you turn it into um, without an argument?
maybe ask why they think differently.
Yes, that's good. So maybe you can tell them, can I understand why you say that? And then maybe you can also give your point of view and ask whether they have any concerns. So um, I hope you get my message. The third area is patient communication. Some of the patient mentioned that they didn't experience a positive interaction with you.
I don't really understand that. I always try to speak to patients, but they misunderstood me.
I hear that you're surprised by this feedback. I can understand why it may feel upsetting because you really want to communicate with them properly. But sometimes the patient feel it differently. They feel like, you're being very rushed, very dismissive, and not clear.
But sometimes the patients are difficult and the ward is very busy.
You are right. The ward environment can make good communication very challenging. The time pressure, the interruptions, the distressed patients. But I would like you to think from the patient's perspective. Imagine you're lying in a hospital bed. You're worried about your condition. A doctor come to you and appear very rushed. Even if the doctor feels very pressure, how do you think it will feel to the patient?
They might think the doctor doesn't care.
True. But it doesn't mean that the doctor doesn't care, right? So how do you think you can make the patient feel that their concerns are being heard even when the ward is very busy?
Maybe slow down and let them explain what they're worried about.
Yes, what else?
I could ask if they have any questions.
Good. So you have to check the understanding as well. You can say, um, I want to make sure I explain this clearly. Could you tell me in your own words what we have discussed and what the next step is? How do you think the patients might respond to that?
They might feel that I'm actually checking what they understand.
Exactly. And if they can't explain it back, they give you an opportunity to clarify.
I still feel that I'm being judged unfairly. Everybody makes mistakes. I'm still a student. Once I graduate, I have more experience and I'll improve.
I hear that you're being judged. I don't want you to feel labeled as a poor student. True, everyone makes mistakes. You're still learning. I'm not asking you to avoid any mistake, but because you're going through graduation soon, we need to identify any gaps now rather than assume they will disappear afterwards. So let's try to improve these challenges that you're facing. Um, what makes you confident that these particular difficulties will improve automatically with experience?
Oh, because I'll be doing things every day and I'll get used to it.
True, when you keep on repeating, it can build competence, but you need to remember that you need to have reflection and feedback. You cannot keep on doing the same things over and over again. Okay, so I want to turn this conversation into a reflective exercise. If the same patient came back tomorrow, what would you do differently?
I'd probably slow down and let them explain their concerns before responding.
Good. What if they appear not to understand your explanation?
I'll explain it again and ask them to tell me what they understood.
Great. And what happened if you're not sure about a clinical decision?
I'll tell the supervisor earlier instead of waiting.
Exactly. So this is the change I'm looking for, greater awareness and deliberate improvement. I like us to agree on three priorities together. From everything we discussed, what do you think should be your first priority?
Probably clinical decision making.
Agree. What specific action could you take?
If I'm unsure, I should explain what I'm thinking and ask the supervisor earlier.
Good. Let's make that our first action. What would you like to focus on for teamwork?
Asking questions if I disagree with someone.
That sounds practical. And for patient communication?
Listening more, giving patients time to talk, and checking what they have understood.
Good. So we agreed on three actions. First, recognize uncertainty and escalate earlier. Second, you need to communicate your clinical reasoning and engage constructively with the team. Third, use active listening and teach back with patients. So I'm sending you an email about a reflective record. Okay, so you need to write down um, one situation using four questions, which is what happened, what did I do, what was the impact, and what would I do differently next time. And I will review all this during our follow-up. Does this plan seem achievable to you?
Yes.
Is there anything you think we should change or add to the plan?
No, I think that's okay.
Good. I want this plan to be realistic to follow. Okay. You have strengths, you've demonstrated willingness to learn, and I'm grateful that you are, being engaged and listening to me and accepting what I'm saying. We will arrange a follow-up session where we can review your reflections. Before we finish, anything else you'd like to ask? Anything you feel I haven't understood about your situation?
No, I think we've covered it.
Okay. Thank you, Anna. I'll follow with you regarding our next meeting. Thank you so much for speaking openly with me today. Bye bye.
Uh,